Hello, you're watching the Policy Times, world's first policy and development media. We have been organizing, conducting different kind of shows to educate and spread awareness among the mass with regards to many policy and non-policy related important issues for the world. COVID-19, we all know how it has impacted the whole world. It has not only taken lives of people, but it has also disrupted the whole world economy. And as people say that it may take like many years and decades to fully recover from the damage that has occurred out of the COVID. Now, while we were thinking we are coming out of the COVID, suddenly there's a new version like Omicron, which came and again disrupted the whole ecosystem. As I see that the cases of corona was coming down, but the latest figure by the ministry again shows that the cases, there are 6,450 cases has been registered in last 24 hours. That's again quite shocking. And out of them, 650 cases are connected or are related to Omicron. Now, just also to give a brief, worldwide till now, 28 crore cases have taken place, and out of them, 54 lakh people have expired and died. In India, if we talk about, there are total corona cases in India is approximately 3.48 crore and 4.8 lakh people expired, died out of it. And out of them, many are doctors, health professionals. From the fraternity, I have Dr. Hafeez from Lifeline Hospital, Chennai. Dr. Hafeez, welcome and thank you so much for joining us today. The first question, along with your introduction, I would like to know that how do you see the impact of COVID? How do you actually picturize the whole impact and journey of COVID till today?
I am Dr. Syed Hafeez. I am MD General Medicine and a critical care consultant. So I have been treating COVID ever since the pandemic started in India and when the cases were rising. So to start with, the journey of COVID is, it's a pandemic. We haven't seen a pandemic in last 100 years or so in such a big magnitude. There had been outbursts of small, like let it be Ebola, you call it SARS-CoV-1 or anything. This is all easily restrictable. The problem with this COVID was that the rate that it could transmit infection and the reproductivity of the virus and how fast it can spread and kill the patient. So that is the issue. Okay. So when this pandemic started, when Wuhan the cases were being reported, the WHO was rightly doing its job by alarming the nation, alarming the leaders of the world, alarming the leaders of the country about a possible healthcare disaster of a global concern. So this was the message that the WHO was telling everybody right from mid-December. So the leaders of the world, the leaders of the nation did not, took the words of the WHO very seriously. They thought that because they have seen Ebola, they have seen SARS-CoV-1, they have seen MERS, which was just restricted to Middle East, and Ebola, all this, they thought this is going to be something like this, so we don't have to worry. Many nations, they did not take it seriously. They were all watching, but WHO was so telling that no, this is not a normal thing. Don't take it lightly. It gave guidelines every time and now that from this part of the world the cases are being reported. From this part of the world the cases are being reported. You need to prepare yourself. So what was it? To prepare yourself in the sense they told that there is going to be an increase in the demand of your personal protective equipment, from masks to PPE kits to everything. So all this was being done. When China was facing the heat, we were relatively, at least India, we were relatively fine. So US and China were facing the heat initially, and that time there was absolute scarcity of PPEs in the place which was the ground zero for the pandemic. So in such a situation, we did not mind or take the words of WHO seriously, and we were thinking about exporting PPEs. We were thinking about exporting masks. We were thinking about exporting uh, all the equipments to the places where this there was a demand for all such equipment. So as we say, people see opportunity in a disaster. That is what the business community in India saw when the COVID was there. So initially, the government of India took a very right step by stopping the export of PPE, stopping the export of masks, because they wanted to preserve, have some for as a backup for our country, our nation, if there was going to be a backlash of COVID-19 in our country. But despite all this, then again, for unknown reason, government of India took back that ban,
Right,
and then there was rampant export. So
right,
rampant export that landed in the doctors, in the healthcare professionals facing the heat in middle of the pandemic, going and working without PPEs or reusing PPEs or reusing the mask. So that was a problem. So
right.
as we
Now,
progress,
right. I understood the background and context. Now, the point that I want to come to now is the Omicron. Now, there is a new version or modified version of the virus, which is spreading slowly, and it is expected that it is going to again spike shortly. How do you see Omicron as a threat, and what can be the possible impact of this Omicron in future?
so it is too early to give a clear-cut answer to the question you have asked. At current point of time, any health expert can answer in ifs and buts as far as Omicrons are concerned, because the November 28th is when we named it. November 26th or 28th is what we named it, Omicron, as a variant of concern, and it's just actually 1 month that we have studied Omicron. So it is too early to say how the impact of Omicron is going to be globally. But what out of our experiences, we're completely handicapped during the COVID-19 when it started in 2019 or 2020. India was facing the heat because we absolutely had no data, no idea about how this disease is going to progress and what is going to happen. But over 1.5 years, in fact 2 years of global pandemic, we have understood the disease, we have understood the virus, we have understood the virus behavior, and above all, vaccine. So now this Omicron now is a variant of concern. We are all understanding, we are all reading. So the data about last 1 month we have, again I'm saying, it is too early to commit what this virus is going to be. But last 1 month, we have understood this Omicron variant of COVID-19 is relatively benign than what Delta was. It is relatively benign than any previous version of COVID-19 variant of concern. So this variant, this 1 month data, again quote unquote, this 1 month data suggests that this is a little weaker virus. How do I say this is a weaker virus? Because the complication is relatively less in last 1 month of the global data we have about the Omicron. Comparatively, compared to Delta or compared to any other thing, this is relatively less. Okay, so there are two schools of thoughts which say the reason why the mortality is less is, one group of experts, they believe that vaccine is helping people, and there was one other group of people which is saying no, this virus is not being attacked by the immunity which the vaccine has given, but this virus as such is a weaker virus, so immunity is acting. So vaccine has no role in the outcome of Omicron variant of COVID. So it is still debatable. We need time to precisely say what exactly is the reason why the pattern of disease is less severe, if at all it is less severe, or more data would suggest otherwise. And we don't have to like break our head like, is it Omicron or not? What we have understood, it was Delta wave, which caused the second wave in India, or now it is Omicron, because at least in Tamil Nadu, out of 34 patients of COVID-19 whose the whole genomic sequencing was done, 33 turned out to be Omicron.
Durable. Okay.
Omicron. So in USA, 73% of patients whose samples were taken for whole genomic sequencing, it is Omicron. So Delta is gone, Delta plus is gone, it is Omicron everywhere. It is Omicron everywhere. So it is going to be any COVID which is coming now, it's going to be a Omicron variant invariably, at least 90% of the cases. Now, the biggest problem which the healthcare is worried, this mutation, this variation in the COVID-19 is missing the PCR test, which means you could still have Omicron, and whatever technique which we used for last 2 years to detect COVID-19 is not going to help us. You could still be having Omicron in you, and PCR which we are currently doing could be negative. So this is where the problem is bigger. So this will give a false negative or a false sense of assurance, saying that I am not COVID-19. I can still be having an Omicron variant of COVID-19, but my PCR is going to be negative. I can still be infective to other people. One data is it is weaker and the infectivity is high. So this is the problem which we as a healthcare are worried. And the second problem, what we are worried is about, are the vaccines going to help us? Because with the Omicron variant, we are seeing reinfection. People who got infected in early 2021 or in late 2020 are getting reinfected with Omicron variant of COVID-19. So only positive data that we have so far is this virus has certainly become weak. It is not going to affect the mortality rate. Is not going to be so high like how we had it in Delta or Delta plus.
So basically a mild virus, but slowly and maybe silently spreading across the world, because the current diagnostic infrastructure may not be able to track may not be able to actually diagnose the effectiveness of this virus. Okay, so understood. What would be the what kind? So it is not deadly. The first thing is clear, but we have to be careful. What kind of policy suggestions worldwide different countries are taking, or precautions countries are taking, and what should we do in India?
That is what now, because the WHO is being overcautious because of the history over last 2 years, how nations handled this COVID-19. So the policies, as we all say, no lockdown till your health infrastructure can manage the daily cases. So no lockdown till your hospital beds are full. No lockdown till your health infrastructure cannot manage number of positive cases per day. So I don't think now there is a consensus that lockdown is not the first solution to contain COVID or any variant of COVID-19, but rather bring in norms and regulate, monitor and scrutinize if the norms are being followed all around the place. Because it's very natural for people to go into a fatigue in following these norms. How long can you keep wearing masks when you go out? How long can you not socialize? How long can you not have events at your, because that's totally you cannot avoid. When this variant is an issue, when this variant is under study, which this variant is under under scrutiny, little more caution is what we need, and that is what all countries in WHO is rightly doing. So as a policy, there's nothing new, because the mode of spread of COVID-19 is no different than what the current Omicron guy is doing. So we don't need a drastic shift in policy towards managing this Omicron variant. It is as same as the wearing mask, as same as social distancing, and as same as washing your hands.
And also because people have already developed immunity with the help of the vaccine as well as with the help of the spread of the first version of the coronavirus. I think so. With that little bit of immunity, self-immunity, with the help of vaccine, I think this virus may be mild in that nature. Maybe, can I say so? So
no, that is what we do not know if that the immunity of the previous version is helping or is it the vaccines helping. It is too early to say. But
right.
whatever it is, whatever is doing, but this virus is not harming as the previous variants of COVID-19 was harming the human.
Right. So let us be cautious and careful, but not full lockdown is needed as such so far.
So I am telling you is that don't get this panic of
yeah. So let us not
another
panic.
lockdown, the panic of another disaster, panic of another economic disaster.
Fine. The other important aspect that Dr. Hafeez, the final question that I would like to know from you is that cancer, due to cancer, more than almost 10 million people die every year, and more goes unreported. And now corona, total death is around 5.4 million worldwide in the last 2 years. Do you think it is slightly overrated, overhyped than many other similar diseases that are causing much more death in the world? Maybe road accident kills more people than corona. The total number of road accident deaths are 20 times more than the corona death that has taken place. Yeah, your view.
Yes. Actually, this 5.4 million, many experts believe is an underreporting.
Yeah.
It is underreported. It is actually underreported. The percentage of or the numbers of people who have died of corona is at least 2 times more. At least 2 times more, because many in India they say like everything. It all depends, because the data will be accurate only if all the deaths in the world happen in an hospital institute setup, and it is being diagnosed as COVID-19. When there was a second wave, when there was the first wave in India, what we could see is people dying at home. We never knew the cause. The sad part is, only 19% of deaths in India happen in hospitals. So 81% die outside the hospital. It is the same for COVID-19 also. So we are not able to establish the cause of death in 81% of the patient. It could still be corona. So this ratio varies from country to country. So there had been undiagnosed COVID deaths in the community. So you add on, it is more. And comparing it with other diseases, yes, I agree. But here the problem is, this is preventable. This is definitely preventable if you follow norms, because cancer you cannot avoid. Cancer is going to come. It's going to come. You can't. You don't have a specific method to prevent cancer. You don't have a specific method to a community policy to stop people dying from heart attack. You don't have a community policy to stop people from dying from things like heart attack, cancer, etc. But this is certainly preventable. And why this is being hyped is because nobody, or at least majority of them, do not rush to hospital with cancer and they say, I don't have a bed. Majority of the road accidents, they don't go to the hospital and say, there's a mass casualty and I don't find a bed. But whereas COVID-19 can kill you because there is no infrastructure, or the infrastructure is overburdened, right? This is not the same when it comes to cancer. This is not the same when it comes to road traffic accident, or this is not the case when it comes to other non-communicable diseases. The concern why this is over-talked is because there is a very big possibility, very good possibility, that you might succumb to COVID-19 because the health infrastructure is overburdened. In other times, this death can be preventable. So that is why we are very much focusing on a COVID-19 pandemic.
Right. Thank you. Thank you so much. We had Dr. Hafeez from Lifeline Hospital based in Chennai sharing his views about the Omicron virus and the corona pandemic situation in the world. As suggested by him, that the Omicron may not be that dangerous like the previous virus as so far, as per the statistics we have in front of us. But we have to be careful. Maybe a full lockdown is not needed, but some careful steps can be taken. More awareness can be spread so that we can stop or reduce, mitigate the spread of this virus. Thank you. Keep watching the Policy Times.
Thank you.